from cancer of his gut.
Sorry.
Mr. Jackson was suffering from gut cancer, and for this, actually, for last 4 weeks, is on some treatment which was used to reduce his pain, and also patient some blood transfusion. This much I know about him.
Okay. I highly appreciate your knowledge about your brother. I'm sorry for what happened to your brother's suffering. Yes, I'm so sorry to tell you that although your brother is still receiving blood, but the bleeding is still ongoing.
Oh my God, doctor, the bleeding is still ongoing. Then
Yes,
how is
I'm.
my brother now, doctor?
Yeah, now he is fine, and because he received 10 units of blood to support him, and the treatment team did what's called endoscopy. This camera test. They put the camera test through his mouth. I will draw to you. This is the endoscope pipe. It's very thin pipe. It's through the gut, through your brother gullet till his stomach, and his first part of the small gut. They found the bleeding is they found too much. They found ongoing bleeding, and they decided to do again this camera test, but they will put some material on the blood channels that that cause bleeding. This will stop bleeding. Is it clear for you, Mrs. Tila?
Okay, doctor. So you tell me that the endoscope couldn't stop bleeding, and now some kind of special material will be given, and they will stop the bleeding, right?
Yes, Mrs. Tila. Throw the camera test again. They will put this material in the blood channel before before going to the procedure room. He will be given some medications cause sedation, that the pain will be minimal, and in the procedure room experienced and well trained team
Mhm,
will do the procedure for your brother.
mhm,
And after that, the treatment team and the concerned staff will keep following and monitor your brother, because some side effects as any procedure are expected, but the benefits are too much weigh the side effect. Is it clear for you, Mrs. Tila?
yes, doctor.
So this how that what how the procedure will be done, but the expected. And this procedure is very important, because giving too much blood all the time, when because unless this procedure done, the bleeding will still ongoing, and this
Mhm.
and giving also the blood all the time is not good, because giving blood also carries a risk, carry many risks, and can cause something like called allergy, can cause a problem for the heart and kidneys. And so the best treatment in your for your best interest for your brother is giving this doing this procedure. And is it clear for you, Mrs. Tila?
So, doctor, blood is giving blood is so much harmful. Then why did you give just 10 units of blood to my brother? Why didn't you just go for the procedure in the first place to manage
Thank
him?
you. Thank you for sharing me this point, for sharing this point with me, Mrs. Tila. As like a treatment team first doesn't want to do because some patients can the bleeding can stop spontaneously, and giving blood to as a first attempt to support the patient and treat the patient. But after those too much units of blood, the bleeding, I'm sorry for that, for it doesn't it doesn't stop. So so decided to do this procedure. Is it clear for you?
Yes, doctor. But
Yes.
you know, um, One of the doctor in my last meeting told me that the condition of my brother is not that good, and he has a kind of cancer which has already spreaded so much. Then why you are putting him again and again to such kind of procedure which is so much painful for him? What's the point of doing this, doctor?
Yes, yes,
Can you help my brother?
I can acknowledge your worries, Mrs. Tila. I'm sorry for your brother suffering. Yes, he is the cancer is spread in his body. I'm so sorry for that really. But but the issue is it is not ethical and not also by law to leave your brother bleed till death. We should this your brother in palliative care supported now submitted now to palliative care. The aim of palliative care, the purpose for palliative care to control any to make the patient's life as as normal as possible, as decrease any reverse any pain, any bleeding, any malnutrition, anything can affect the patient will should be treated, and the patient's life will be as best as possible. For this reason, the palliative treatment decided to stop bleeding because this bleeding is risk for your brother's life, and it will increase. Your brother will suffer too much if keep this bleeding. Is it clear for you?
Yes, doctor, I can understand.
Okay, thank you. And Mrs. Stila, some side effects are expected as any procedure. This may include the procedure may fail, may be failed. The procedure maybe some bug infection caused because of the procedure, and
Mm-hmm.
maybe bleeding also. But those side effects are usually minimal in experienced hands. With that, we have a experienced team that does the procedure many times, and we will keep monitor and following to warrant this will not happen to your brother. Is it okay for you?
Yes, doctor, that's okay.
Okay.
But doctor, my parents are wanting these days that if my brother could be all right, like just like before, they want a curative surgery for my brother. Doctor, is this possible?
I highly appreciate your parents your feelings regarding your brother. I'm so sorry to tell you that, Mrs. Tila, the cancer is spreading, and there is no curative. But we can afford this palliative care to make that including mood doctor, dietitian, and pain control doctor, and also gut doctor to make your brother suffering is minimal, and to make his life free of suffering as much as possible. And any new treatment, because this research is still ongoing, sure our treatment team will help your brother. Is it okay for you?
Okay, doctor.
So, Mrs. Tila, what's uh, did your brother assign anyone to behave on behalf him if he become not able to have decision or to take
No,
care of
doctor,
himself?
nothing like that. Nothing like that.
Did he write any living will?
No,
Uh,
doctor.
okay, all right.
No.
Okay. Well, so, Mrs. Tila, what's your concern?
My concern is, doctor, the main fact is I want my brother's pain to end because I am with him and I am seeing him nowadays, and it's actually unbearable for me to see my brother suffer like this, doctor. I am totally just pissed off.
Really,
I
really,
want you to relieve his pain, doctor.
I highly appreciate your worries and about your brother, Mrs. Ta. I'm so sorry for that suffering, but as I told you, we will keep following, and our treatment team will keep regular following to 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 help your brother and to relieve to relieve any problem, any suffering that your brother may have now or in the future. We will keep following and support for your brother. Do you have any other concern?
Yes, doctor, can you give him morphine for his like pain relief?
So sure, I will raise this issue to treatment team, and as I told you, this procedure will help your brother to to to, to make his condition is better, and we will update you and your brother for everything. Do you have any other concern?
No, doctor.
Would you please tell me what did you gain from our discussion today?
Yes, doctor, that my brother is going to have a procedure called embolization to stop the
Mhm.
bleeding. And also, you are here to help him as much as possible, but no curative surgery is possible in his case. So, doctor, how much time my brother have actually? Please, I want to know, doctor.
Okay, I can acknowledge your worries about your brother. This actually is very difficult to decide how much your brother is because there is a big variation between big difference between patients and patients. But as I told you, we are here as a treatment team. Will keep following and support and any new treatment, anything can make your brother condition is better. But the treatment team will do that. Is it okay for you?
Yes, doctor, that's okay.
Do you have any other concern?
My concern is, doctor, is there any chance that I can take him home in the near future? You have 2 minutes left.
Yes, I highly appreciate your concern, Mrs. Stila. For sure, your brother condition become better and control this bleeding and see your brother is okay, he can go back to his home. Yes, sure, and we will keep following him regularly. Do you have
Okay,
another
so
concern, Mrs.
there's
Stila?
still hope, doctor, right?
Sure, after control his condition and solve this control this bleeding and medical and treatment team become sure that your brother is well for discharge, sure he can go for home, he can go home, sure, with regular following.
Okay.
Okay, thank you, Mrs. Tila.
Thank you, doctor. Thank you very much.
I'll give you brochures and website and leaflets to read more about this procedure, and I will give you also my contact hospital contact number to call me for any question or concern. And
Mm-hmm.
do you want someone to pick you to your home?
No, doctor, that's okay.
Okay, thank you, Ms. Tila.
Okay. Thank you very much. So, doctor's break. Do you want any time for reflection or should we go for the discussion?
We can go for discussion.
Okay. So, what do you think? How was the discussion?
Um, I did my best to explain to Mrs. Tila, sister of Mr. Jackson, about her brother condition and about the procedure.
Okay. So, what do you think? Miss Stella was, what was she wanting actually?
Mrs. Tila, she explained me about her worried about her brother condition, and he wants him. She wants her brother to relieve his pain and his suffering, and she wants that her brother will go back to home. And I tried to explain about the importance of the procedure, and that whenever the medical treatment the treatment team will decide for discharge whenever if her brother Mr. Jackson become better and can discharge.
Okay. So, do you know the difference between palliative care and hospice care?
Palliative care is specialty team that
Mm-hmm.
this have mission to control patient any complaints of end stage disease like
Mm-hmm.
pain, like malnutrition, like depression.
Mm-hmm.
Hospice care is like just like like take care, for example, take care for nasogastric tube, for example, or do like a dressing in the case of bed ulcers, something like that.
Any time limit do you know about the hospice care, like the life expectancy of the patient? How much time this kinds of patient will have, then you will assign them for hospice care.
I don't know.
Okay. And what about end of life care? Do you know anything about end of life care?
I don't have idea. Just I have idea about palliative
Okay,
care.
that's fine. Okay, that's fine. Okay. Okay, thank you, Mr. Zrik. So,
Thank you, brother.
let's come to your criticism now, okay? So, you have
Yes,
done quite well today, okay?
thank
But the
you.
fact is, the pause I told you about in the last class, okay? And being empathetic to the patient,
I do
okay?
my
Like,
best. I'm so sorry. I
okay, yes, yes, you have tried your, you have tried a lot, I can understand, but kind of giving a pause, like offering her a glass of water, offering her some
thank
kind
you.
of tissue paper.
Yes,
These
yes.
things are actually very important. It may look silly, but the fact is they are very much looking after this kind of things. Okay, so
Okay, I will do
whenever
my best.
there is a kind of scenario when the sister is very much shattered, kind of, I tried to act it that she is very depressed, but then you need to be like you need to go a bit slow. Okay, try to go at a slow pace with some pauses. Okay, and the procedure you have described it well, but let me tell you in short about it. Like, yes, we have tried to control the bleeding using a special tube called endoscope, but it failed. Okay, and now what the team is going to do is a special method, we call it in medical term embolization. And here a special blood catheter goes through the blood channels, and it occurs under angiographic evaluation. Okay, and it will be used to locate the site of the bleeding vessel, and after its actual visualization, there will be some blue like agents which will be given to that actual bleeding point, and that will stop the bleeding. Okay, and before the procedure, beforehand, there are some preparations before the procedure, like your brother won't be able to eat for 6 hours, and we will review his drug history like any other procedure cases. Okay, you'll
Okay.
have to know, and your our team will monitor him time to time. You have all told this kind of things. And regarding the complication, what are the complication did you say in this case?
I said failed the procedure, bug infection and the bleeding. I forgot to. I don't. I'm not sure about if the visceral perforation may happen. Is it by
Yes,
endoscopy?
yes,
Actually, I know. Is it by
yes,
endoscopy?
yes. It's under yes, it is under angiographic evaluation. It's through
Mm.
angiography. Okay, and the complications will be, there will be infection, there will be bleeding from the vascular access area, and there can also be dissection of the target vessel. Okay, and also in
Mm.
very rare cases there can be even gut ischemia and perforation. Okay, and another fact is, I told you in last class that whenever I'm asking that how much time do I have, how much time do my brother have, then I always try to ask that, may I know, ma'am, why you are
Mm.
asking this?
Okay.
Okay,
Yes, yes,
so
yes.
that
Sorry.
any hidden issues can get explored by doing this question. Okay, another thing is, you're taking him to home, and how much time does he have? Okay, you will have to be in clear words that, ma'am, I acknowledge your concern, ma'am, but the fact is, the cancer in your brother, in his case, it has spreaded a lot, and I'm very much afraid to say, ma'am, he may have a few months. Okay, but we are here to do as far as possible. We are here to help him as much as we can. You can trust us, and our whole palliative care team, our guard doctor, our multidisciplinary team, our occupational therapist, our Macmillan nurse, they are all here to help him so that he can live a normal life. But The fact is that the cancer has um, spreaded a lot. Okay, you will have to tell her the truth. Okay, that's a truth telling part. You can't give false hope. Taking him to home, it's a kind of very a scenario of very later part. Even it cannot be possible sometimes because there is a disseminated bowel cancer and patient is having embolization, some kind of late stage it is. Okay, so you can tell her that we will follow her up and our consultant will take decision regarding this condition. Okay, but you will have to tell the truth also, but in a very empathetic manner. Okay, tell the truth in a very empathetic manner. Another thing is regarding your palliative care, hospice care, and your end of life care. Okay, when the life expectancy of the patient is less than 1 year, and another indication is dementia. These 2 points, life expectancy less than 1 year and patient is having dementia. In these two criteria, we actually assign the patient for end of life care. Okay, and regarding hospice care, when the life expectancy is less than 6 months, then we give the patient hospice care. These all are names of the palliative care, but the time duration is different. Hospice care for less than 6 months life expectancy, and end of life care is for less than 1 year life expectancy and for dementia patient. And can anyone tell me what is Liverpool care pathway?
Sorry, what?
Liverpool, Liverpool care,
Only
Liverpool pathway.
consultation if there is any association for this problem and what's your concern. So we are familiar with the disease and we are mentioning disease every now and then. So simply your brain map for the eye problem is going to be mainly UDM 5Ps. So let's move to the next page then, and any volunteer.
Okay, the Liverpool care pathway, it actually provides the best quality of care in dying patient in their last hour and days of life. And the goal is to ensure a death which is dignified as peaceful as possible. Okay, this is Liverpool care pathway, and this is actually involved in the last stage of dying patient, so that we can ensure a death which is dignified as peaceful as possible. Okay, so this all kind of palliative care things you will get it better in your Team Hall book. Okay, Team Hall is good for your palliative care pathway. You will get that the end of life care, hospice care, Liverpool care pathway. All these pathways are there in the Team Hall. Okay. And another thing is your pain management. Regarding that, you will have to tell that we will involve the pain clinic and also the palliative care team, and we will raise this issue to our consultant. You have already told that regarding his pain management. And do you know the flow chart? Like we can't give morphine actually in the first instance, right? So the flow chart is, at first you will have to try with paracetamol, then you will have to go for NSAIDs, then you will have to go for codeine, then morphine, then hydromorphine, and then oxycodone. This is the flow chart for pain pathway. Okay, they sometimes ask about this regarding pain management. So first paracetamol, then NSAID, then codeine, then morphine, then go for hydromorphine, and then oxycodone. Okay. Hello, Dr. Zwick.
So, sorry, doctor. I know oxycodone. Oxycodone is also like codeine. Is also given by tablet oxycodone.
Yes, but maybe the flowchart I got from book in Oxford, maybe, but you can also review that. Okay. But whenever I took preparation, the flowchart was like that, the pain care pathway. Okay.
Is it possible to share those small files about those hospice care and the end of life care, and also this chart of painkiller given for in palliative treatment?
Okay. In the last class, if I get the files, these are all in handwritten. Okay. But
Okay.
if I get any
This is
file,
very
I will
helpful.
provide it to you. Okay.
Mm. Okay, thank you.
Okay. So this is all about our first case. So try to go slow in any palliative care management and try to look more empathetic. Okay.
Okay, sure. I do more.
Otherwise, it was well. Okay.
Thank you,
Yes.
doctor.
Otherwise, it was good. Thank you very much. So our next case here, Dr. Suparna. Are you willing to take the next case?
Yes, that's fine. Yeah.
Okay. So your role will be you are doctor in accident and emergency clinic, and you will have to talk to Mr. Borison, father of Stuart, a 16-year-old boy who was previously got admitted into hospital yesterday with traumatic head injury due to a school fight and a blow in the head. He was transferred to ICU and his condition deteriorated further. ICU consultant declared him brainstem dead. Mr. Borison was out of the city during the accident. He is here to know about son's current health condition. Stuart had a donor card that was done previously. Now talk to Mr. Borison regarding this and address his concerns. Okay. So again, you are going to have 14 minutes before Mr. Borison leaves the room and 1 minute for reflection before discussion with the examiner, and you are not actually allowed to ask any questions. Okay. So Dr. Supana, if you
Okay.
are ready, then let me know.
Okay. Yeah. Okay, I'm ready.
Okay. Start.
Hello, Mr. Stewart. I am Dr. Suparna. Uh, are you father of Borison?
Read the scenario, Dr. Supana. It's Mr. Borison, father of
Oh,
Stuart.
sorry. Oh, sorry. Okay, sorry. Let me start again then.
Okay. Okay, start.
Um, yeah. Hello, Mr. Borison.
Mhm.
I am Dr. Suparna. I'm one of the doctor in A&E. And are you father of Stuart?
Yes, doctor.
Okay. Do you want to take a seat here while we discuss about your son?
Yes, doctor. Thank you.
And do you want anybody by your side while we discuss about your son by your
No,
side?
doctor. No, doctor. It's fine.
Okay. Okay, Mr. Borison, uh,
Mhm.
I am afraid to tell you that I don't have a good result with me, actually. I don't have uh, I can't, uh, like, it's difficult to say, but I have to tell you that your son, Stuart, uh, he he has suffered a very bad injury, and then he was having a brainstem death.
What, doctor?
I'm sorry.
It must be something wrong. What you're seeing, my son is only 16 years old, and there is just a minimum. There is just a school fight, and uh, everything should be all right, doctor. We must be something. There must be something wrong, doctor. You just check the records. This can't be true. This must be someone else. It's just a simple school fight I had over telephone, and I have come to see him and take him home, and you are saying this, doctor. That's not possible. That's not Stuart. Check the records, please.
Okay. Mr. Borison, I can understand how we are feeling right now, but I have to tell you that we are absolutely sure that it is Stuart, and we have checked him twice, and then we are very sure that it is Stuart, and he has suffered a quite a like detrimental injury to it, leading to such condition.
Oh God, what are you saying, doctor? Is
Um,
it even possible? He is only 16 years old, and what kind of blow this was in his head? And what you are telling the
right.
brainstem death, I don't understand. What is brainstem death? Is he dead or alive?
Yes, Mr. Borison, I am here to explain you more about it. You have a very a valid question. And before that, may I offer you some water? Are you feeling all right? Or do you want to take some time if we discuss this more in detail?
No, doctor, go on. Thank you for offering water.
Again, I'm really sorry that we are meeting in such a circumstance. Um, okay, so what I want to say is that brainstem is an area, if I can draw you something, if you would like to see that this is the brain, what it looks like in anybody's body. And there is a special part which is called brainstem, which has all the important center which control our breathing, our circulation, our blood pressure, and our consciousness as well. Uh, in your in Stuart's case, what happened is that the injury to the blow has happened so severely that it has actually affected this vital area called this brainstem. Are you with me, Mr.?
Yes, doctor, I am with.
Okay. So if somebody has this area been damaged, then it is actually death. Like he is under some respiratory support, that is support in terms of um, taking the breath as well as the blood pressure. But actually, when we will take out all the machine, then he cannot take normal respiration or taking the breath. So that's why we consider it as almost dead. It's actually death, but it's supported. Still, all her vital function are by controlled by all the machines which he is attached right now.
Doctor, so
I'm really
what
sorry.
if the machine is going on and sometimes he can return, right, doctor?
Yes, Mr. Borison, that is a very valid question what you are putting. I understand how you are feeling about it.
Hello?
The thing is that once the brainstem is
Hello?
dead, then actually there is no chance of these centers to regain its power to work again, like the respiratory center, the breathing center, the blood center, all this. So his body will take the breath or maintain the circulation or the blood supply as long as he is on support of this machine. And this machine actually we if we continue this machine to go on for long